Health of the nation. I believe that we are on the verge of a disaster because of RFK Jr.'s take on how the Health and Human Services Department is going to be run. But something really caught my eye where you saw Sean Duffy and RFK Jr. going into airports and talking about what needs to happen with changing what's inside the airports. And that's somewhat related to the health of the nation. So I'm going to start there and then go to the more ominous ways in which I believe that this government under HHS, under RFK Jr., is making our country less healthy. So in the airport, Duffy says, maybe I want a workout area where people might get some blood flowing doing some pull-ups or step-ups in the airport. It's the most absurd thing. So you put in free gyms in the airport, and that's going to take care of your health, and that's what the airport needs. Commentator and reporter Garrett Graff commented that I can't believe how much the Trump era is about solving problems that don't exist while making all the problems that do exist worse. There's no one who thinks the biggest problem with air travel right now is not having an area to do pull-ups. It's true. The problem we have with air travel right now is that there is a shortage of air traffic controllers. And we need our skies to be safe to fly. So why is Duffy focusing on gyms or jungle gyms in airports when he needs to worry about hiring more air traffic controllers? And then there's Brooke Rollins, the agriculture secretary, saying eggs are going down, everything else is coming down. But listen, we're not tone deaf. We know that a lot of Americans are like, well, we still are not feeling the relief. The relief is coming, she says. It really is a golden age just right around the corner. Right. And SV Dot comments, he's a commentator who comments saying, this is so dumb. Nothing is coming down. Biden used to claim correctly that inflation was diminishing and it was better here than in other industrialized economies. And he was accurately derided as tone deaf. I don't agree with that sentence. But what Trump and his enablers are doing is so much worse. Biden was given, I'll tell you this much, was given an economy in free fall, inflation skyrocketing, and America reeling from a pandemic that had taken 1 million American lives. 1 in 330 Americans died. So, what is important for us to notice is that Biden brought us back from the ledge. And he was right in saying that prices are coming down, but he could not get prices down to before the COVID pandemic because it is a Herculean task. And had Donald Trump followed through on Biden's policies and kept the economy going, we would not be in a place where coffee is 100% more expensive, twice as expensive. Ground beef is 14% more expensive. Bacon is 3.5% more expensive. Chicken is 5.3% more expensive. Bananas are 8% more expensive. Lettuce is 7.4%. And this is coming from Maria Bartiromo's show on Fox, which is as big of a propaganda outlet as you can get. And they are reporting these against the narrative of Donald Trump's administration. So even Fox can't bend the truth when it comes to inflation and how that's impacting the health of the nation, in how we go about our business, in how we feed ourselves. for people who live paycheck to paycheck, a 14% jump in ground beef is a big deal. Because if it was, $1.85, now it's $2 for you to get ground beef. And that makes a difference for people who are counting pennies. And somehow this oligarchical regime doesn't get to understand that. And Aaron Rupar made a brilliant comment about pointing out that Donald Trump has not really been in society for decades. He hasn't bought gas or bought groceries for decades. So he doesn't really understand what normal people who go to groceries and who look at their bank accounts really go through on a day-to-day basis. He really doesn't have an understanding of that because he hasn't lived that life. So from this, let's jump to the hepatitis B guidance that the CDC has come out with. Hepatitis B is a highly infectious disease that impacts newborns and infants and causes widespread death, and it was 99% reduced and eradicated before this new guidance that came in. So CNBC reports that Health and Human Services Secretary Robert F. Kennedy Jr. hand-picked vaccine committee voted on Friday to do away with the long-standing universal recommendation that all babies receive a hepatitis B shot at birth, issuing weaker guidance for certain infants. The group, called the Advisory Committee of Immunization Practices, recommended that parents use individual decision-making in consultation with a healthcare provider to determine when or if to give the hepatitis B birth dose to a baby whose mother tested negative for the virus. For babies who don't receive the birth dose, the committee recommended that they wait to receive the first vaccine until they're at least 2 months old. Now, this flies in the face of the previous guidance of giving them this vaccine at birth. NPR reports Dr. William Schaffner, who is a professor of preventative medicine at Vanderbilt, says that his advice to expectant parents who are on the fence is to talk to their doctor about the shots. Even if the pregnant woman has tested negative, he said, it is still important to give the baby the birth dose because false negatives are possible and because the virus can spread so easily from surface contact. If you wait a month and if the mother happens to be positive, or if the baby picks it up from a caregiver, by that time the infection is established in that baby's liver. It is too late to prevent that infection. He said that if fewer people get vaccinated, hepatitis B will circulate at higher rates in American communities, and the risk of contracting the virus will rise for everyone who doesn't get the shots. More hepatitis B cases could mean higher costs for patients and the broader healthcare system. So that is the warning that we have right now. It's absurd and hugely problematic that RFK Jr.'s handpicked vaccine council is now commanding essentially what babies should be given at birth. That contravenes medical advice and decades of medical expertise that has established these health practices. Now let's jump to measles. Remember measles? In a November Harvard article, Dr. Robert Schmerling says, as I write this, there have been 1,753 confirmed cases of measles in 42 states, mostly among children. This is the largest number of cases in a year since 2000. when the disease was declared eliminated in the United States. CDC's December reporting, as of December 2nd, is that there is a total of 1,828 confirmed measles cases that were reported in the United States. There have been 46 outbreaks reported in 2025, and 87% of those confirmed cases are outbreak associated. To compare, 16 outbreaks were reported in 2024, and 69% of those cases were outbreak associated. So in 2024, there were 285 cases of measles in the country. And in 2025, 1 year later, it has been reported that there are 1,828 confirmed cases of measles. So that's a big jump in 1 year. So it's important for us to look at where our country is going when it comes to infant health, when it gets to the health of our babies, and what RFK Jr. and his health department, Health and Human Services Department, is doing to endanger children while they recommend installing jungle gyms in the airports. It is a dangerous place for America to be, and we are endangering the lives of the most vulnerable in our population. We need to pay attention to this. We need to talk more about it. We need to be loud about it. And we need to reject these ideas that RFK is coming up with and go back to the CDC and the FDA and Health and Human Services working to the benefit of Americans instead of in adverse interest of America. But that said, thank you for listening. Please pay attention to the news. Please remember to like, share, and subscribe, and I'll talk to you soon.